Hello, everyone. Welcome to a new episode of our People Power Health Insight series. Today, we have a very special guest, Dr. Shoma Saha, and she's going to be talking a little bit with us about health equity and about some of the work that she has been leading in the recent years. So, welcome, Shoma. How are you?
I'm very well. Thank you so much for having me, Sam.
Thank you. Well, we usually start our conversations with our guests with a very simple question, and that is if you were to walk inside of a room full of people that you have never met, how would you introduce yourself in that room?
I would say hi. I'm Shoma Saha, and it is a privilege to be here with you today. I'm interested in knowing you and sharing with you a little bit about the journey we've been on to create a movement of better ancestors.
Thank you, Shoma. Um, okay, so one one thing that we usually love to know about our guests is how was that moment? How was that process of deciding to go into healthcare, into medicine? How was that for you?
So for me, I grew up in a family in that made about $10 a month in Kolkata, India. Small town of about 18 million people at the time that was riddled with these contradictions. On the one hand, there was incredible poverty right alongside incredible wealth. And on the other hand, what you saw in the midst of what is considered poverty are some of the most remarkably creative, resourceful people in the entire world. So when we lost electricity every night, my mom and I would spend time on the veranda. And she was a math teacher, so she'd ask me a lot about math and made sure I was good at math. But the other thing she would do is say, look at the world around you. And as I looked, and as she said, your job as you grow up is to do everything you can to make the world better. For those who don't have it, it really struck me what an incredible wealth of human resources was going for millions of people just to make it through the day instead of being used to contribute to create the solutions that are needed in the world. Fast forward a few years, I am an undergrad at Harvard, and I get there and I see for the first time people sleeping on the streets. And I have to tell you, Sam, I had no idea why they were there. Like, I understood why they were there in India, where people had left the villages and needed in search of an opportunity and a chance, but I had no idea why they were there in the poorest, not only in one of the poorest countries in the world at the time, but also in the wealthiest country in the world outside the wealthiest university in the world. And so the only way I knew to begin to understand that was to just spend time asking the stories of the people, the men and women who were on the streets of Cambridge at the time. And as I heard their stories, I began to understand how poverty was different here than it was in India. And at the same time, how common it was that there were these enormous structural inequities that perpetuated not just health inequities, but other inequities. So along the way, as I went along, what I was a more traditional biomedical route of loving molecular biology and then looking at what it would take to become a doctor, which I loved, loved doing. What I came to also ask is what are the systems and policies that are leading to the same outcome in such vastly different places? And what does it take to begin to shift those?
That's amazing. And I love how you talk about exactly that last part, how to shift these things. And one follow-up question that I want to ask you is looking at some of like the amazing work that you have been doing in recent years, there is this like word of community very present in every step. And I would like to ask you, is there any particular like story besides the one that you just shared with us that made you realize like how important it was to have this community center approach to what we do in healthcare.
Yeah, absolutely. I not only in listening to the stories of the people that were in Harvard Square, but as I went on to have the privilege of working in Guyana with indigenous communities that had enormous wisdom and gifts to offer, what I came to realize was that, in fact, the real answers, some of the pieces of the puzzle that we were missing, what I thought of later on as I became a health system improver at Cambridge Health Alliance and then at the Institute for Healthcare Improvement, was that it was communities who actually held the pieces of the puzzle that were that what made up the plateau in our graphs. They held the pieces of the puzzle that and the assets we needed to actually solve the problems. And so what we didn't need to do was rescue people in communities that were experiencing inequities. We needed to shift the system so that their voices and contributions and power and leadership could join together, not to be led by us, but so that we could collectively see the whole picture together and begin to change and build a picture we wanted to see together of the world we all want to have for our children and grandchildren.
Now that you're mentioning about that that world and that place that we want to have, I know that there is a new project that is coming along that is Justice Square. And I was wondering if you could share a little bit more with us about how Justice Square came to be and what is like it's going to be launching in the next few days. So yeah, I was wondering if you could share a little bit more about that with us.
I'd be delighted to. So Justice Squared grew out of hundreds of people, both across healthcare at every level of those creating change and communities of everyone who wanted to see change working together and beginning to say, what is the healthcare system we want and what would it take to get there? You know, I'll say that a word that kept coming up in that conversation and that kept coming up throughout my actually quite long career now in working to improve health systems are words that are very simple, like love and justice. The idea of a healthcare system where people feel known and loved, where the systems give dignity, where possibility, where they're fair and just. These are not complicated terms, but
Mhm.
they're complex to think about how we get there. And what was really beautiful about the process that initially was led by the co-creative team and then was handed to us to steward to build Justice Squared was that the hundreds of people identified a series of concrete shifts of what it would take to get there. So they didn't just have a vision or an aspiration. They began saying, what would it take to really do that? And so that led to the birth and design of Justice Square. And is where we are today, which is where we're beginning, knowing that addressing structural racism in healthcare to create the conditions for love and well-being for everyone requires us to begin by taking accountability and getting in relationship. So we can't take accountability without being in relationship with those who are most affected, without knowing and hearing those stories, just as I'd had the privilege to listen to and hear, but also knowing and hearing the solutions that communities experiencing inequities had to offer. And so the first part of Justice Squared invites people to get in relationship with communities and resources that so that relationship is equitable. The second is to take account by beginning to say, well, where is there racism in the system? Structural racism is like the air we breathe and the water we swim in. It's hard to see and make visible. So the second part is, where is there racism in the system that's invisible, that is therefore not being measured? What would it take to measure it and take account and to change it? And the second is, where have we baked in racism in our diagnostics and systems, not just in the practice of clinical medicine, but in the way in which we think about how we send bills out to people in a way that inadvertently, where we in healthcare become part of who is impoverishing communities rather than healing them? What does it look like in the way in which we determine who is or isn't deserving of a transplant? What are the protocols and policies and structures that decide where we site a new medical facility and when we don't? And by bringing together not just a collective of communities, but a collective of people within the health system that hold a different piece of the puzzle, we think that we can make practical changes specifically today. But more than that, we can create changes that we can build a method, a way of being and doing in relationship that can help be replicated thousands more times and will need to be replicated thousands more times to create a just health system.
Exactly. No, no, thank you. Thank you for that. And as you were mentioning how structural racism is like here and like the water around all of us. I was just like recalling there have there have been recent events that are like a backlash against diversity, equity, inclusion, about work with anti-racism. And I was wondering, as the collective around Justice Square is getting ready for the launch, and in light of these events, what is, in your opinion, what is the best approach that can be had as the first step to maintain health equity as a priority? Because I mean, this backlash that is around anti-racist work is really present and is really strong. How can that be better addressed in your opinion?
Sam, I could give you a super technical answer, like from a population health perspective or a healthcare economics perspective. When we don't treat and eliminate racism and poverty, we will lose our shirts. Literally, we will healthcare costs will rise and have risen at a level that is unsustainable.
Mm-hmm.
And while much of my career has been built on demonstrating that and even in fact showing that when we advance equity and justice, we save hundreds of millions of dollars a year that could be reinvested to creating the conditions for our well-being. So one part of the answer is it's just what makes sense. Like it is actually about restoring healthcare to what it was always meant to do, to be a healer of people and communities and to use our power and privilege in a way that does that. But I'm going to offer you today a different answer that I've been really thinking about, which is, part of this work. So backlash against efforts at justice is normal. It is predictable. This is what has happened throughout all of history as people have taken steps forward. In fact, it is a sign of progress. Healthcare is a sixth of the economy. I don't think we need to let people who are afraid of making progress toward a justice system that works for everyone, that means that we, all of us, can have the security and safety we need and for ourselves and for our loved ones. We shouldn't let people who are trying to create an unjust system and profit from it stop us from doing what is needed. In fact, I would suggest that this is the civil rights movement of our time. And that the way to take action isn't to be afraid and to crouch. It's instead to get ready, to be prepared, to build a collective of people that can address that together, to take back our own power and to use it in a way that creates a just and abundant system for everyone.
I love that. Thank you for sharing that with us. And I completely agree. This is definitely the civil rights movement of our time. And one short question related to this last part of what Justice Square will be like working with and doing. If you were to look into the future, into the next few years, could you describe, like looking back in these recent years, that Justice Square achieved its purpose? How will the healthcare system look like if not only if, but when this is successful and achieve its goals?
As one person said it, it's a system where love runs throughout. But more personally, it would mean that I wouldn't have to worry about how my child will have access to healthcare long after I'm gone. I won't have to worry about the thousands of patients and families that I had the privilege of taking care of, where we had to do everything we could to navigate them through a system that didn't work for them, and instead could look at the beauty and power of what happens when their ability to contribute to a system, to their own health, to be there for their kids, to be there for their families and communities, their workplaces, all of that is possible because we've created a system that creates health and well-being and doesn't impoverish them in the process. And the third thing that I would say is that, health is best achieved and marked not by what we can measure within the walls of our healthcare system. What we call and talk about is birthdays regained and bedtime stories told between grandparents and grandchildren. And I think that if we can begin to understand and see that this work is the work of telling bedtime stories and celebrating birthdays and the wins, that the things that will be possible because people live lives of well-being that were not marked by their struggle to survive, but were marked by their ability to live and contribute to grow families and communities and to solve the collective challenges that we face as humanity. I think that's a pretty good definition of what health means.
Amazing. No, thank you for that definition. As we start to approach to the last part of our conversation, I want to ask you, there are upcoming elections in the US, and they will, I'm sure, have a potential impact on how healthcare policy is conducted and is developed. What will your advice be to emerging healthcare leaders who are working on a...
That health equity requires participation in a process to safeguard and to build the health systems we need. And that participation needs to be at every level in our communities, in our institutions, in our schools, in every part of our democracy. Because when we have the ability to choose what healthcare means to us, and I think that's the part that we have to understand and be honest about, Sam, is we're in a moment where the issue isn't necessarily whether people are engaging in democracy. It's how they're engaging and what that looks like, and how we begin to think that we cannot have the health care or the housing or the access to lifelong learning, all the vital conditions that we believe everyone should have, if we aren't willing to ask for it, to fight for it, to work for it, to build for it, to sacrifice for it. But when we do that, we all gain. In other parts of our nation and in some parts, in other parts of the world, people aren't so insecure about their health as they are here.
Right.
And if we want to feel secure and safe, then we need to have the courage to invest in the us, in the we together. And I think that in order to do that, we need to stop seeing each other as other and begin to know one another's stories, to begin to know one another's lives and perspectives, and invite each of us into that common practice of a democracy that works to create health and well-being for everyone.
Thank you. Okay, as we get to the last part of this conversation, we usually ask some quick, short questions to our guests. This has been a really inspiring conversation, and I wonder, for this last part of the recording, is there a book that you like will recommend people to read if they are really interested in getting to know more about health equity and about what can be done?
Gosh.
I'm sure there are lots.
Yeah. So I was trying to decide which one. Actually, the funny thing is, I invite people to start by understanding what creates inequity and
Mhm.
how common it is. And so the two that I often recommend to begin with is our Caste by Isabel Wilkerson and The Sum of Us by Heather McGee.
Amazing. Thank you. Um, the second question is there any video or movie or documentary that you have enjoyed and that you would recommend people to take a look at?
But I would say Unequal Treatment might be a good video to start with if you're beginning on a health equity journey.
Thank you. And my final question is, if you had the opportunity of sitting down and having a cup of coffee or a cup of tea with any person from the world's history, who would that be and why?
Mahatma Gandhi.
Amazing.
Why? Oh, well, two reasons. My great grandmother had the privilege of actually organizing as part of the independence movement in India. And what I loved about the way in which that movement was structured was that it wasn't about one thing. It wasn't just about independence from the British. It was actually about what does equitable governance look like? What is a way of look like that lifts up women, that breaks the yoke of caste, that begins to create the conditions for self-sufficiency and economic liberation look like. And so so it was the depth of ways in which it focused in which Gandhi focused as a person on what a practice of liberation looks like. And I think what I'd want to do is just listen and learn from him. But also I would want to know, given that he said that the methods that he used wouldn't have worked for those who couldn't see the humanity in one another, couldn't see any humanity in one another, I'd want to know what he would suggest.
Amazing. Thank you very much for this conversation and for being with us today. And I would just like to invite all of our listeners and followers to take a look into Justice Square and to get involved with this collective action that is going to be developing in the next few weeks, months, and years to come. Thank you, Dr. Shoma, and thank you everyone for joining us today.
Thank you so much, Sam.